Welcome, my name is Kim Haley. I am the breast cancer survivor that has been on my mission of Medebra. I woke up disgusted in what I was put in, and I developed the product for 2 years. We designed additional features no other garments have, with a reimbursement piece as well. I want to start out by telling you the way the product is packaged. It's packaged in a sealed packaging that also we're recommending or putting it out there that the doctors are and clinicians are the people that are helping us with this movement of having Medebra placed in the OR where the need starts. Then we place one on the floors as the product is used, one to wash and one to wear. Now inside, for the mastectomy bra kit, we have a set of soft fiber filled adjustable breasts, and they are also packaged inside separately, so if you were to use them the next day, they would still be very clean. Also, some of our surgeons will put them on right after surgery, and some will wait till the day afterwards. We'll talk more about the prosthetics later. I wanted to start out with the body itself. The body has no seams on it. Everyone else has seams, and seeing as you are laying on them, a seam would be about here where other garments have them, and it's very uncomfortable. We have our labels on the outside, because even a label can be disturbing to a patient. I hope by now they've passed around a garment so you can touch and feel the difference and the softness of the material, and also of the support. We have the body that is designed to come below the sutures for certain surgeries such as breast reductions. Also, the opening is Velcro. It provides easy access for the clinician and for the patient. With the Velcro, we have 1/8 of an inch all the way around so that the patient isn't scratched in any way. If they were to not have perfect contact, the female part of the Velcro would touch your patients, and obviously that's not going to hurt them. Now the straps, we developed this for easy access, but the other feature that this provides, the strap is designed so it doesn't dig into the port area. A lot of us don't have a lot of fat there. Now, whether this is for ports or chest catheters when you have dialysis. The easy access opening of the strap, when closed, if you will feel it, actually provides a padding over that area of the port where a lot of us don't have a lot of fat on it. The strap is also designed that if you have a woman with ribs taken out and they're concave, you're able to extend the garment. Again, there's no skin contact with a rough Velcro on them, and they're able to pull the garment below the concaveness. I've had patients that have never been able to wear a garment with prosthetics that are wearing them now. We also want to talk about the pouches. The pouches will hold up to 4 Jackson Pratts on each side filled. They do stretch. Afterwards, when the drains are taken out, they're simply removed. The female soft part of the Velcro is left on the garment. There is a space below so it doesn't irritate your patients. And these will turn into another set of soft fiber filled adjustable prosthetics, as in one to wash and one to wear. The prosthetics are sized according to the size of the garment. For instance, this would be a small and this would be our 4X, which sizes up to a 250-pound person for women. We do have a man's garment that will size up to a 300-pound person, man. The prosthetic is soft, it's fiber-filled, and yes, it's adjustable. There is a hole on purpose so that they can remove the soft stuffing if it gets soiled, and they can wash it. Also, there's a lot of women that have lumpectomies and they're left lopsided. They're able to take and adjust it according to what they feel they would like. The nurses have found this for us. They're using the prosthetics also for pain control and placing them. During reconstruction with the expanders, a woman has a pointed look, which is unnatural, and all we want to do is feel normal, anybody, sick or well. So what they'll do is they'll place them in over on the sides, and they'll give themselves a more rounded look, making themselves feel normal. Sending all of our girls home with a set of breasts is a secondary healing aid that can't be matched. As little girls, we identify ourselves as growing breasts. Sending your women home with a set of breasts will help them improve their recovery. Now the pouches, they are also going to help in reducing drain infections, which can lead to readmissions. So like I was telling you, we would re-talk about this. The stuffing would be pulled out and it would be put in here. There's a piece of Velcro, it'll be turned, and they do have a place for the prosthetic. Now, when I say that my mission has been to have them put in the OR, and that it is the place of origin, majority of the time that is true. Again, with multiple biopsies though, what the nurses are doing, they're just putting an ice pack in here, and it keeps it in place. Also, with our pouches, they will not only hold our prosthetics, but they'll hold anyone else's later on if they would like to graduate on up to, and they choose not to have reconstruction, they will hold other prosthetics as well. We do have a men's garment. We do want to provide not just comfort, we want to provide dignity. As you can see, I have my pink signature heart. We're not going to lose our heart, it is in white. And the men's vest opens up opposite, much as a man's shirt would button opposite. I do appreciate your time. Most importantly, as a patient, I appreciate your compassion to help the sick, and I hope that that you have picked up a few features that you aren't able to have with the other garments. Now let's talk about one last thing. When we're sizing our patients, when you're putting them on in the OR, we don't want them too tight. They're going to swell some, and you need to not put them on too tight. There is a little bit of movement here, about an inch of tight, that you could tighten it and let it go as things go on. The Velcro is very strong to hold. So please, especially with the flaps, do not put them on too small. I wanted to say, if you will take a look at the chart over here, a 32-34, for instance, would be a small. If the patient's on the top end of the scale, such as a 34C, then I would move them up to the next size, just because we know there's going to be swelling. Again, thank you so very much. If you have any questions, please reach out to us. Our email address is on our website. There's more information on the website and testimonies from international and national surgeons, such as Dr. Corinne Becker, who has endorsed us for chest wall lymphedema. I appreciate your valuable time. Thank you so much.